Hello everyone, my name is Claire.
And I'm Ben.
And we are your dental besties.
Making dentistry fun.
We make dentistry fun. And today...
Our jingle.
Oh, we said we were going to start doing jingles.
Yeah.
That's my jingle. That's my contribution.
Like a ukulele next time.
Yes.
Can you play ukulele?
I could give it a go.
I can't.
I could give it a go. I'm not going to say it's good.
Oh, true. You said I'd give it a go.
I didn't say it was going to be good, but that's my contribution to our jingles. So now we have two.
Okay, cool.
Do you know what I find really odd is like when we listen to the podcast, obviously when it's been through production and the lovely team have made it amazing, it's got music in the background. So you know when we say, hi, I'm Ben and hi, I'm Claire.
You're waiting for it to kick in.
Like, where's the music?
It's in the background.
It's in the background now, but it wasn't when we recorded it and it threw me. I'm going to go straight into an agony on call. Okay. I'm doing some research into dental health, oral health, and all of this in relation to menopause and perimenopause.
Oh, well, you've come to the right place.
Come to the right place. Any recommendations for papers? Or anything I can read?
I mean, there's so much out there. I think my advice would be to go on a course run by us.
So dental, of course, obviously this is up our street. This is what we are bringing to the UK next year. This is what the whole roadshow is about. Bringing that information, bringing that research, making it all easy to understand, because when we read it, it's not always necessarily easy to understand. I think that's
the problem. That's why it's like, is there any research or papers? Yeah, there are like hundreds, thousands.
Yeah.
But I think the issue is sometimes you get so bogged down in the research and the academic language, you struggle to translate that into what do I actually need to do for the patient?
Yeah.
And hence why we're running the course.
Yeah.
It's something that we both believe in quite strongly. Mm-hmm. And I always like it when I go to a course. It's a massive topic, but they just give me the nuggets that I need to know.
Yes. The takeaways.
Yeah, the takeaways. What do I need to do? And what do I need to know about this specific condition? And how is it going to affect my clinical practice?
Yeah.
Boom. That's what I'm paying my 150, 200 pound, whatever it is for.
Yeah.
And I think it's worth it because it's almost like AI.
Yeah. So we're basically AI.
Basically robots. We'll go away. Robots. We'll do all of the work, research it, present you with the latest evidence, the latest papers.
Yeah. Make it interesting and easy to understand. Give you the nuggets that you need. Tell you how to explain that to your patients as well in a way that they can understand, and then boom, there you go. You're an expert.
That's it. Done.
Yeah.
In a day.
So we're traveling all over the country, and it is literally on the topics that they want to know about. So we go from cradle to grave. So we're actually going to give you that and more. We're going to go from cradle to grave in the sense that we're going to go from puberty all the way through in women's health to menopause. We say grave, but we don't literally mean grave.
No, you're not dead. Don't worry.
Yeah, we're not dead. But yeah, and everything that journey encompasses. So, even down to sort of endometriosis, contraception, because that's going to play a part, pregnancy, IVF, fertility. Yeah, so we're going to cover all of those bases. Anything hormone related is going to be covered. So it's what you are probably asking for plus more. But yeah, it does affect things, doesn't it? Massively. Hormones and oral health is a big thing.
I think it's interesting that it's becoming more mainstream. And I think there are celebrities who've like really pushed for it to become like, I want to say normalized. How crazy is that? 2024 and we're normalizing the menopause.
Which has been going on for like millennia.
Forever. But I do think it's helped, but it's also created a lot more questions, especially in dentistry.
Yes.
We think, teeth, oh no, you're not going to get a hole in your tooth if you're going through the menopause. But now we're knowing more about linking everything together, and that's the whole that systemic factor.
Yeah.
And you were reading something super interesting.
Yes. So
you sent me the screenshot.
Let me find the screenshot. I did send you the screenshot. Let me find it. Blah, 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 blah. Bear with me a second. Okay. So yeah, so it was in the Times. Because this was literally like yesterday or the day before, wasn't it?
Yeah, it was very recent.
I've got the screenshot up. So Dr. Naomi Buckley, I think that's how you pronounce her name, a scientist working on breast cancer research at Queen's University Belfast, tells you we've only recently learned that the breast has its own microbiome, which can be affected by changes by the oral microbiome.
See?
Oh my God. What
else? What else? We're just going to find out so much more. I feel like it's exciting because I'm like waiting for it all to come out.
This is why I say my mission is to make biofilm sexy. Not sexy like in the sexy term of the word, but in the sexy term of the word, like something we want to talk about.
Bacteria.
No, I mean, don't sleep with bacteria. It's never good. We just want to take a second to say thank you to our sponsors who want to show their support to hygienists and therapists by sponsoring this podcast.
So we've been super picky because we only want to work with brands that we endorse, use, recommend, and feel like you could benefit from knowing about. We do want to say a real big thank you to Scrubs, Boutique Whitening, Dr. Hef's Mints, and Oh My Gob.
Details for our sponsors can be found in the show notes.
And if you want to sponsor season 3, then get in touch.
On with the show. No, but I mean, just in the sense that it's something that you find interesting. It's something that you want to talk about with your patients because they need to understand it too, because it does affect their systemic health. It's not just caries and perio anymore, it's your body too.
Yeah.
So we need to talk about biofilm with our patients. It carries on here to say, we're looking at a bacterium called Fusobacterium nucleatum, which we know is involved with biofilm. And it's associated with periodontal disease, but has now been linked to cancer. Well, me being me, I'm like, I can't just have that information and not fully understand. You know, I don't want to just,
you would have been like, clear the diary.
I was like, clear the diary. You know, like on films where they like go swipe across the desk and everything's like on the floor, and then I'm like,
research mode.
I was in research mode. It was fascinating.
Fall down a rabbit hole.
Fell down a rabbit hole, ended up adding it into like my lectures, because when I talk about like women's health, I'm like, well, I need to put this in there as well. So Fusobacterium nucleatum, obviously we know that is involved with biofilm. That is a key pathogen which changes the biofilm. It's the one in the middle that causes the biofilm to become mature and pathogenic. It's kind of a shit stirrer. That's how I'm going to explain it. It's the shit stirrer.
Shit stirrer of the mouth.
Yeah, because everyone's probably got it in their mouth. So it's in our mouth all the time. It's not necessarily bad all the time, but something happens to cause it to go from like not, you know, innocuous, not really that bad, to suddenly pathogenic. And it has the ability to be able to also get into the bloodstream as well. And it can adhere to epithelial and tissue cells as well. So the reason why it's linked to cancer, I'm basically giving away dental, of course, here. But the reason it's linked to cancer.
Getting it for free, eh?
Getting it for free. I'm just giving you a little snippet, a little teaser. Come on our course. In fact, actually, I think I'm going to add it to the roadshow.
100%.
Can I add it to the roadshow? Okay, so amazing. So it basically gets into the bloodstream and then goes and can attach to tissues and tumor tissue. So that's how they found that specific bacteria actually attached to tumor tissue in the breast, in colon cancer and things like that as well. And it can actually cause that tumor tissue to actually rapidly grow, because it hides in a very layman's term, or a layman's way of explaining it, it can hide that tissue and that tumor from the immune system.
Oh my God. Because the immune system thinks that it's that bacteria.
Yeah. Well, it actually, so the bacteria hides itself a little bit from the immune system. It can manipulate the immune system. And so it allows those tumor cells to continue to grow. It can actually cause cells to mutate as well. So it can actually cause a localized area of inflammation, say, for example, in the breast tissue. And then that localized area of inflammation can cause this like actual tumor growth to occur.
Do we know why it does that?
Well, it can modify the cells in the sense that it can alter the cell's function. It can get into the cell, alter the cell's function, and cause changes and mutations.
But why does it do that when it travels around the body?
So it can just attaches to cells. It's one of the. It's
just random. It doesn't know where it's.
Yeah,
going.
I don't think it's necessarily that it sort of likes specific cells. I feel like I saw epithelial cells a lot. So, but it's also implicated in colon cancer as well. It can actually protect. So there's a certain protein. There's a certain protein that seems to be the thing that changes it from innocuous to pathogenic, and that is, I think it's called FAD-A. So it releases like a type of protein that can protect, it causes it to be sort of protected against things like acid and stuff. And that they seem to find in the research, it's that protein that changes it from being okay to not okay. And they think the reason it's found in colon cancer is because that having that protein can protect it against acid in the stomach, and digestion. And so that's how it ends up in the colon and causing problems in the colon. But with breast cancer, it's from when it gets into the bloodstream and can travel around.
Oh my God, that
scary.
is so interesting.
So again, it takes me, remember I speak a lot about Porphyromonas gingivalis, which is a red complex bacteria involved usually in the deeper sites. That's another one that can invade the soft tissues, get into the bloodstream, circulate around the body and cause havoc with systemic diseases and pregnancy and Alzheimer's. Like that's the one that's implicated in those things. But this Fusobacterium nucleatum, that's earlier on in the sort of the biofilm maturation process. It's the one that can kind of cause the biofilm to become more nasty. So it's another reason why our nemesis is biofilm. We can't afford for it to be stagnant and stay in one place for too long, because this happens. And it's the stress put on the bacteria at a certain point is when it changes and produces that protein.
And by stress, what do you mean?
I think it says when it goes into I think it said starvation. I wasn't 100% sure. So I'm being honest, I'm not obviously a scientist. This is all through my research, and this all happened within the last 2 days.
Yeah, I mean, come on.
So
by the course, I know.
I'm good, but I ain't that good. But yeah, by the time of the course, obviously, I'll have done a lot more research and I'd actually be able to give you the studies and stuff that I've looked at. But yeah, it seems to be where it's involved in the biofilm maturation process. Then there's an element of stress in there, and it said starvation. So I'm wondering whether during the biofilm maturation process, there's an element of it not having the nutrients it needs, and so it lays that down.
I'd say maybe as periodontal disease becomes as it develops almost.
Yeah,
it's an anaerobe.
Yes, so it's an anaerobe.
Yeah.
A key pathogen, which means it's a key pathogen within the biofilm that causes the changes. So yeah, not good. So it's another one. You know how I always say, I would love to know what bacteria are involved in people's perio. The thing with Fusobacterium nucleatum is we all probably have it in our mouth. Well, we all have it in our mouths, but it doesn't necessarily mean that it's bad. Okay, so whereas it might be bad, when they looked at the diseased sites and the healthy sites, it was there in both. The difference was this protein it had released. So the bacteria in the disease sites had released this protein and caused these clumps that you could see in the visuals. And so it's in there. So the presence of it isn't the thing that's the problem. It's the presence of it in that state is the problem.
Yeah, so something happens obviously in health to disease that makes it turn this protein on. There's a
stressor that causes it to go, I'm going to turn this protein on. And it's called FAD-A, I think, this protein.
And then obviously as it travels around the body, the biomes are all going to be different. So whatever it was kind of using to survive in the mouth isn't there. So then it gets that stress and then changes.
Maybe, yeah. So we can work this out between us.
Oh God, it's actually terrifying though. I think that we have this...
Yeah.
All these little shit stirrers or triggers in our mouth.
Yeah.
All the time.
Yeah. And so they find the DNA of these bacteria in tumours and things like that. And it's like, wow, that's a bacteria only found, it starts off in the mouth and it ends up somewhere else. Another reason why we need to make sure we manage our patients' biofilm. We're biofilm disruptors. It sounds like we're like Ghostbusters.
It's more worrying that we have a dental crisis.
Yeah.
We're knowing more and more about the systemic health issues related to poor oral hygiene or poor dental health, but yet we're in a dental crisis.
It's like this information needs to get out there so people understand it more, so that we can be seen as a more vital part of the general health optimization of wellness movement,
Yeah.
It seems so sad that we know all of this information. We're so passionate about it, but yet the society doesn't care as much as we do.
It kind of comes back to politics and government and I don't know. I think this is kind of going off topic now, but I think when you're in school, you don't get taught life skills. But yeah, I'm talking about brushing your teeth, but I'm just also talking about caring for your body.
Well, we learn it off our parents, our primary care or our primary caregivers. Who's to say that they got it right in the first place? And then who's to say that their caregivers get it right?
If your parents taught you how to brush your teeth, for instance, the point that they're teaching you, that knowledge is X old. So it might be 35 years old. And then the previous generation would have taught them, and that knowledge would have been 25 years old.
Yeah.
So then that knowledge is 60 years old that it just makes sense. I don't understand the school system. I feel like it needs overhauled.
Yeah.
Things like banking and stuff. We don't get taught anything about how to manage your money.
Life skills. There should be life skills lessons. We used to have do you remember PSE? Or was it called?
Yeah. We got taught how to put a condom on at 17. I was like, that ship sailed.
No, they do. Well,
long.
You need that at 14 these days, don't you? But you also need, how savings work, exactly how to wash yourself, how to brush your teeth, how to floss, and why. I think parents out there now listening, if you're not dental, obviously, if you're dental, we pin our kids down and make sure they brush their teeth. My son's 14 and I'm still chasing him around the house. But parents that are listening who aren't dental, like be the point of change now in terms of oral health. Yeah. And start instilling routines now based on you learning more so that you can pass on that knowledge. Like, it might be too late for you. You might have a mouthful of fillings. That's fine. But
it's never too late.
It's never too late. But pass on that information now so that your next generation, your kids, are sending the right message then to the next generation of kids. And it's not 60-year-old information that becomes 80, 90-year-old information. Be the point of change.
Good.
Yeah. Oh, that was a nice this was like a little, throw it in there, wasn't it? Have you noticed we've been wearing scrubs?
I was just about to say, I feel like I don't want to take them off. Is that acceptable to go out in this?
Actually, don't take them off because we're about to do Pilates in the next episode and do some stretching. So I'm going to wear these because these are really nice and comfortable, nice and stretchy. And some of the Pilates you can actually do in surgery. So let's move on to the next episode. So anyone listening, next Monday, you're going to learn a bit about Pilates and how to do that in surgery.
I'm going to try and teach Pilates on a podcast, which I'm not sure is going to work.
Well, then they have to watch the YouTube.
I have to watch the YouTube.
You have to watch the YouTube.
I'll do a few. I'll do a few little stretches, exercises, and then maybe I'll do like a Instagram.
Yes,
for our Instagram.
We should do that. But it's not going to be all that. We've got like some talking points as well, so there will be some talking points. But definitely head over to the YouTube to watch that. But if you have enjoyed this episode, which I think is a great little, even though it's a short one, I spoke quite fast. When I get passionate, I think I do speed up. That's one of my faults. But it was a nice little trying to throw a bit of information at you. So if you liked today's episode, please like, share, comment, subscribe to the YouTube, subscribe to the Spotify, and tell everyone about it.
See you next week. Bye-bye.